Thank you, Mr. Speaker. Healthcare costs continue to rise. In 2013, a hospital stay cost 25% more in Alberta than the national average, while in 2017 it cost 35% more. The average cost fell by $34 to $59.92 nationally, but rose $459 in Alberta to $8,112. The Yukon reduced the cost over the same period by $835. Why hasn't the government been able to get hospital costs under control?
Great question.
Well, thank you, Mr. Speaker. And as I pointed out in my last set of questions, we have moved down the rate of growth in healthcare spending here from 9.2% in 2010 down to just 2.2% this year. And so that's in keeping with the growth of the population. I think that's a great accomplishment that we need to carry on. Certainly, there's measures to continue to look for controlling costs, but that does not at the expense of healthcare and the security that healthcare provides for all Albertans.
Given that in 2013, Alberta's large urban trauma hospitals had an average of 8 patients waiting for a hospital bed per hour, which has risen to 11 this year, and given this metric has remained stagnant at medium urban hospitals, and given the government has increased its health budget from $18.6 billion to $20.7 billion, why have Albertans not seen improvements to their health care experience?
Very good question.
Thank you, Mr. Speaker. And, as I said, I dispute this notion that we've not seen improvements in targeted areas. We certainly have. There's lots of room for improvement always because healthcare is dynamic, and healthcare is the most important, not just for your own personal physical health, but for peace of mind. And, Mr. Speaker, what you don't do is like the former leader of the Alberta Party who came in here unelected and proposed $1 billion in cuts in healthcare.
Second supplemental.
Given AHS released its provincial diverse population strategy over 6 years ago, and given the social determinants of health must be supported by sustainable programs in the social services sector, and given every week constituents complain to us about frontline social services workers who fail to understand or respect diverse needs, when will strategies to reach out to underserved populations start collecting input that supports service improvements?
Great question.
The Honourable Minister. Thank you, Mr. Speaker, and a very good question. And it's very important that we integrate healthcare outcomes with other ministries as well. For example, in education, we are building partnerships between mental health strategies, between Alberta Health Services, social services, and education. And, the degree to which we can find that synchronicity, I think that you can really see market improvements. What you don't do, though, is blow up hospitals, blow up health systems, or talk about private healthcare as the UCP has been. That's not the way Albertans operate. That's not the way we deliver healthcare in this province.